In this video, we will discuss the bones of the upper limb, a short review on their anatomy. Introduction. The upper limb consists of bones that provide structure, support, and mobility, facilitating a wide range of functions from gross motor activities to fine motor skills. How many bones are in the upper limb? There are 206 bones in an adult human skeleton, out of which 64 bones are present in upper limbs, right plus left. Each upper limb has 32 bones, major bones of the upper limb. The upper limb is divided into four main regions: the shoulder girdle, arm, forearm, and hand. Each region contains specific bones that play distinct roles in movement and function. First, we will see the shoulder girdle. It consists of two bones, clavicle and scapula. Clavicle. It is also known as the collarbone. It is a long bone that connects the sternum to the scapula. Structure of clavicle. It is S-shaped, with a medial sternal end and a lateral acromial end. Function of clavicle. It acts as a strut to keep the scapula in place, allowing the arm to move freely, away from the trunk. The second part of shoulder girdle is the scapula. It is also known as the shoulder blade. It is a flat, triangular bone that lies on the posterolateral side of thoracic cage. Structure includes the spine, acromion, coracoid process, and glenoid cavity. Function of scapula. It provides attachment points for muscles and forms the socket of the shoulder joint. Number 2. The arm. Arm consists of only one bone, called the humerus. Humerus. It is the long bone of the upper arm that runs from the shoulder to the elbow. It is the longest bone of the upper limb. Structure of humerus. It consists of the head, neck, greater and lesser tubercles, shaft, and distal condyles, that include capitulum and trochleus. Function. It articulates with the scapula at the shoulder, and with the radius and ulna at the elbow. Number 3. The forearm. The forearm consists of two bones, radius and ulna. Radius. It is the lateral bone of the forearm, running parallel to the ulna. Structure of radius. It consists of the head, neck, radial tuberosity, shaft, and styloid process. Function. It articulates with the humerus, with capitulum part of humerus at the elbow, and with the carpal bones at the wrist, playing a key role in forearm rotation. Ulna. It is the medial bone of the forearm. Structure. It includes the olecranon, coronoid process, shaft, and styloid process. Function. It forms the elbow joint with the humerus, trochleus of humerus, and provides stability to the forearm. Last of all, is the hand. It consists of three categories of bones: carpal bones, metacarpal bones, phalanges. Carpal bones. These are 8 small bones, arranged in 2 rows, at the base of the hand. In the proximal row, these are scaphoid, lunate, trichotrum, and pisiform. In the distal row, these are trapezium, trapezoid, capitate, and homate. Function of carpals. They provide flexibility and a range of motion at the wrist. Metacarpal bones. These are 5 long bones of the hand, numbered 1 to 5, from thumb to little finger. Structure. It consists of the base, shaft, and head. Function. They form the framework of the palm, and provide attachment for muscles and ligaments. Phalanges. These are the bones of the fingers and thumb. There are 14 phalanges in each hand. Distribution. Each finger has 3 phalanges, proximal, middle, and distal, while the thumb has 2, proximal and distal. Structure. Each phalanx has a base, a shaft, and a head. Function. Enable fine motor skills and dexterity.